Well, in the REVEAL trial, we had the opportunity to collaborate with the Oxford group in doing a worldwide study, and they've recently presented the results that I think are important. This looks at how can we try and further improve risk and the residual risk that our patients with coronary or vascular disease have, using a modification of the lipids that incorporates a huge increase in HDL and further lowering of LDL. And so the CETP inhibitors are able to have a big impact, and the drug Anacetrapib can more than double the HDL, and it further lowers LDL by roughly 20% or so. And so it looks like something that could be a great add-on to statin therapy. And so working with Oxford, we do large, big trials, and so 30,000 patients were enrolled worldwide. We had a run-in phase where we got everyone on very intensive statin therapy, either atorvastatin 80 or 20 milligrams, but to get the LDL to on average 60 or 1.5 millimoles, and that was at baseline. And then we added anacetrapib or placebo and then treated for an average of 4 years. So this is a very long trial as well, and so thousands of endpoints to get a real answer at the question of, does CETP inhibition help improve outcomes? And so what we saw was it did. It was a modest reduction, but a significant one, a 9% reduction in the primary endpoint of coronary death, MI, or need for coronary revascularization. There was, as has been seen in other trials, no difference in mortality, but MI and coronary revascularization were both improved. Interestingly, no difference in stroke. And when we tried to sort out, was it the doubling in HDL or the lowering LDL or related fashion, the non-HDL, they nicely plotted out the results of all the prior statin trials based on the non-HDL, all the bad cholesterols, and plotted the line, and that's where REVEAL falls spot on that line. So the amount of non-HDL lowering seemed to relate to the amount of clinical benefit. So then conversely, we said, well, what about the doubling of HDL that we've thought would be so important from epidemiologic studies? And that didn't seem to have a big effect in any case, so don't totally exclude it. But there's not what we used to expect out of HDL, a big further impact in outcomes. Well, this is the fourth trial in this big outcomes trial in this space, and the first three failed. Torcetrapib had some toxic effects, and then dalcetrapib and evacetrapib had no benefit whatsoever, completely neutral. But both the trials were stopped early and were smaller trials, so they had many fewer endpoints. And so it's a good clinical trial lesson that we have to be patient and wait till we get the full follow-up and large numbers of endpoints. So we're approaching 3,000 primary endpoints. So a huge trial that we can really get a firm answer with adequate power to make sure that we're not missing an effect. And so that's probably the biggest difference. The drug itself is a little different. Anacetrapib stays in the body for a long time. It sort of accumulates in fat cells, and we actually measured that in the study. And so its effect is very long-lasting, and that may have an impact on having a positive result. Well, I think conceptually, this is now the fourth class of LDL-lowering drugs that shows a benefit. And so that had been a hot topic of, is it only statins? But we have ezetimibe, PCSK9, and now the CETP inhibitor, when tested fully, that lowering LDL improves outcomes. And so amazingly, that has been questioned in recent years, but I think this helps reaffirm that lowering LDL is really a major way to improve cardiovascular outcomes. I think the second thing is another nail in the coffin of HDL. Many people say, but we haven't ruled it out yet. But there's certainly not the big impact of HDL. So clinically, I keep my focus on LDL, and even in the people with low HDL, I lower the LDL further. Should this become available, it would be another option. Could be, if people can't tolerate statins or can't get to goal with the available therapies, this would be another option potentially. But it's certainly still investigational and not available for use. But I think there are some good lessons learned to focus on the LDL, and that can help improve outcomes.